For my informative speech, this is my audience, my mom and my sister. Close your eyes and imagine the most intense fear you have faced. Think of how it felt, how it consumed you. Were you sweating, panicking, short of breath? Did you have chest pain or feel like you were choking? Now imagine this happening on a daily or weekly basis. This is what it is like for some people who live with anxiety. People who become better educated by knowing the definition of anxiety, the effects it has on a person's social lives, and how to effectively treat anxiety. Anxiety is a mental health disorder characterized by feelings of worry, anxiety, or fear that are strong enough to interfere with one's daily activities. This is typically about an event or something with an uncertain outcome. Anxiety is the most common mental illness in the United States. Over 4 million Americans suffer from this disorder. Only 1 out of 3 Americans and 1 out of 5 teenagers that suffer from anxiety actually receive treatments. It can be manifested through general anxiety, phobias, social anxieties, panic attacks, and separation anxiety. Anxiety can also occur with depression, bipolar disorder, personality disorder, and eating disorders. A phobia is a type of anxiety disorder that describes an excessive and irrational fear of a specific outcome, activity, or situation. Social anxiety is characterized by a strong and persistent fear of social or performance situations in which humility or embarrassment may occur. Panic attacks are short episodes of intense fear that are often accompanied by serious physical symptoms and uncontrollable fears of dread and doom. Separation anxiety disorders describes an individual's feelings of persistent and excessive anxiety related to uncertain or oncoming separation from an attachment figure, such as someone who provides the individual with comfort. According to CalmClinic.com, stress can be a leading trigger. Work, school, family, relationship, finance, etc. All these are big stress factors. Use of drugs, side effects of medications, medical illnesses, these are all examples of natural triggers. Invisible triggers could be clutter or unorganization, too much time to think, lack of goal setting, anxious thoughts, health and news, etc. Anxiety disorders develop from the conjunction factors like brain chemistry, genetics, environmental contributes, upbringings, and life events, chemical imbalances, long-lasting stress, family history of anxiety, or other mental illnesses, trauma, drug or alcohol abuse. Medications, side effects can all be factors to put someone at a higher risk of developing an anxiety disorder. To diagnose someone with anxiety, a doctor would do a psychological questionnaire, ask detailed questions about your symptoms and medical history. Anxiety is diagnosed when normal anxious feelings begin to occur with inappropriate intensity and regularity, according to CalmClinic.com. Anxiety symptoms can be different based on the particular condition or disorder, but common symptoms include obsessive thoughts, trouble sleeping, fatigue, headaches, nauseous, sweating, dry mouth, dizziness, heart palpitations, stomach aches, shaking or trembling, inability to calm down or remain calm, feeling of dread or worry or dread, sensation of panic and uneasiness for no apparent reason. Anxiety or disorders are treatable. Most people that suffer from anxiety can resume and live normal lives with professional care. It is recommended that 2 or more treatments be used, for example, supplementary therapy sessions with yoga or meditation. Doctors warn that when someone relies on only one medication, it may not be an effective solution. Treatment options include medication, brain stimulation, exposure therapy, group therapy, cognitive brain behavior therapy, and dialectical therapy. Alternative and supplementary treatments include mindfulness, meditation, yoga, acupuncture, and relaxation techniques. Anxiety can affect a person socially and mentally. Social issues can consist of fear of leaving the house, social withdrawal, changes in personality, trouble at work or school, family or relationship problems, drugs or alcohol abuse, depression or suicidal thoughts, more frequent emotions and physical health issues, compulsive or repetitive behaviors, and extreme unwarranted fear of particular situations or things. With people becoming better educated on knowing the definition of anxiety, the effects it has on a person's social life, and how to effectively treat anxiety, it can possibly help them treat their own. There are different types of anxiety, such as social and separation, phobias, and generalized anxiety. Symptoms include shortness of breath, heart palpitations, sweating, obsessive thoughts, and etc. There are many different ways to treat it, such as medications, therapy sessions, medication, acupuncture, yoga, and more. Thank you for listening.